Please join us for a conversation on COVID-19, youth, and mental health.
Greetings from the St. Paul Baptist Church Mental Health Ministry. My name is Sherry Davis, and I am the co-chair of the Mental Health Referral Ministry. Our ministry offers information and references to our St. Paul family in the area of mental health awareness. Today, we would like to discuss in detail the effects of the COVID-19 pandemic and the impact that it has on our lives as adults and as well as children. Listening to the news daily and hearing the statistics of the number of people contracting the virus and the deaths related to the virus can be quite overwhelming. Distancing from your family, friends, and co-workers, along with the general public, and having to wear protective coverings wherever we go, can take a toll on our mental health and wellness. With me today is Rhonda Love. Rhonda is a licensed psychotherapist and a member of the St. Paul Mental Health Referral Ministry. Rhonda would like to share some of the impacts that the COVID-19 pandemic has on our lives. Rhonda, welcome.
Thank you, Sherry. As Sherry has indicated, we find ourselves today in a consuming situation most have never seen before nor experienced on this scale. It feels like we are under attack by an entity we can't see, don't understand, ill-equipped to fight, and worst of all, don't know when the attack would end. We can't run from it because it's global. It's everywhere. Our freedom to safely move around is compromised. Our educational opportunities are placed on hold to the most part. Many have lost loved ones. Many have lost their jobs. And many are currently suffering from the actual attack of the virus. It has been a challenge for us to wrap our minds around what is happening to us on a global stance. And just imagine just in our own homes what we're making an attempt to do and making sense of what's going on. I want to take a look at that process of how we encode, and that's taking in of information and identify the possible outcomes of such high levels of stress, which oftentimes leads to dysfunctional anxiety and depression. Many of us are suffering from the effects of the stress of learning how to deal with this shift. Through this process, I hope to provide a helpful pathway to reduce stress and increase positive production or positive productive daily functioning. As we take in information, I think it's important to understand that we filter this information through a system. This is a system that we construct. And this system is composed of our socialization, our early socialization, is composed of our past experiences and some incorporated valued opinions of others. So in this, what I call perceptual lens, there's a step in processing information through. So it's important to understand that all these factors I just talked about, our socialization, our past experiences, they're going to lay formats or lay maps, if you will, on our brain. And we call that our memory. And so in our processing and the way that we go through this, there are some steps that we go through. And that first part is as information come in, is trying to align itself with something that's already formatted in our brain. So with that says it's going to automatically search. So this COVID-19, something we've never heard of. So it's searching our brains. This information is coming in, is searching, is looking for something it can relate to. When it doesn't find that, the next step is reasoning. And so with that, we're trying to, then it's that part where we're trying to make sense of what our brain is trying to capture. And so with that, we're making an attempt to draw a conclusion through logical deduction. And as you all have heard on the news, everyone is trying to do the same thing. and our medical professionals from high up are trying to deduct some type of reasonable response to this which we're under attack from, and it's difficult. So if they're having a challenge in doing it, so are we. And when we don't meet up to that measure, our brain is not satisfied on that level, then it comes down to some type of problem solving. And it's in this portion where things become more complicated. And I know for some, I know for me, when it gets a little bit too complicated, we do a couple of things. Some may go lay down on the couch and be there for about a week. That can be depression. For some of us, we get sick. And so these are some evidence of what we call stress. So that stress comes up, and so which is a state of mental and emotional strain or tension resulting from adverse or very demanding circumstances. So as I indicated, we may feel some physical pain in our body. We may have some changes with our sleep patterns, our appetite. We may feel like we have a headache, stomach ache, and then for some people, will experience a spike in their blood pressure. Emotionally, we began to feel more irritable, experience mood changes, anxiety, depression, increase in substance use for some, and that's the behavior piece there. And then also we get angry. And that anger comes because we don't have an answer. And when we don't have an answer, that leaves that void, and we can't control it. And so that can bring that emotional piece there of anger. As we listen to the varied reports of the epidemic, as described above, we are having to learn something new. It doesn't really align with the stories we have in memory. We have a limited capacity for that logic reasoning because, we don't have the capacity as the CDC professionals do, but by any means, just trying to understand where it came from, why is it here, and when is it going to leave. But it pushes us, as it pushed us into that problem-solving phase, we also realize that leaves us also uncomfortable. This means that there's another phase that we need to move into that hopefully will be something we can recognize that will be helpful. This means accepting the fact that today we simply do not have a resolution. It's time to develop a pathway to better deal with our current circumstances in a way that keeps us moving forward in a positive way. And from my perspective, when we're looking at making that move, it's a term I use, and it's called rational acceptance. And to some, it could be a radical acceptance. That means at some point, we have to say, let it be resolved. This is it. And that what I have before me, now I have to do something about it. And begin to look at what skills we have in doing that. If we don't move forward, then we get stuck. And we get stuck with perseverating, and that means ruminating, and that means having that worry go on in our minds. And then it will continue to affect us physically. And then there's no end, and we're stuck. So we want to get unstuck. So one of the first steps I like to address is the awareness. Taking a moment and assess the process you've used to try to make sense of this traumatic event. And it is indeed trauma. It is impacting our lives like none other. Choose to accept our current reality. This does not mean we have to like it. It does not mean we have to agree, but it is what it is. We want to increase our awareness on how stress is impacting us. Take inventory. Think about how this stress is impacting your body. Take some time and think about if you're experiencing some symptoms, physical symptoms that you haven't experienced in a long time. Question that. Why is it happening now? Why am I having these upset stomachs? Or why am I having these migraine headaches? Why are these things happening now? And that may be further evidence of the stress that's going on that you're struggling to get control of. If you have a chronic illness or existing conditions, it's important that you begin to track any significant changes. in those conditions. Okay. We want to increase our awareness because it's going to help us move forward to that next step, which is planning. We want to make a plan that works for you, that is realistic about what you can and will do. For example, if one source of your anxiety is becoming ill with the virus, plan to adhere to the guidelines provided by CDC, and that's the Center of Disease Control. As we are learning, CDC is one of the many agencies that we have available to us that has already been down a similar road as such. And they have answers that we may not have thought of because they've had to handle various situations that we may not even have been exposed to. Since we are certainly not interested in contracting one of the diseases or this particular disease, then taking into consideration and implementing them into our lives may provide greater protection. And some of the protections they're asking that we do is to distance ourselves from others, that we are very careful when we are taking care of essential duties, that we are staying away from other people. Well, I'm hoping that we can create our own imaginary line that the grocery stores are now creating, so we'll know how much distance we need to be away from someone else. We want to be mindful, even if you are sure that you do not have the COVID virus, we want to make sure that we don't receive it, but we also want to make sure that we're not putting ourselves in a position to be a threat to someone else. We want to wear a mask. The newscasts, the internet, there are so many venues out there that are teaching how to make your own mask in your home so that you can further protect yourself and your children. It's imperative you embrace that. If you can't sew, I understand. There are some others who are out there, volunteers, who are offering to do the mask and to give them at no charge. Whatever source you're able to receive it, please get one, because it's important. It's important that we wear gloves. We wear disposable gloves. That also can be at cost, but there are some situations, if you have regular gloves, use that. Whatever that will help the situation where you don't have direct contact with surfaces that may have the virus on it, in some kind of way, then maybe someone else had touched it. You certainly don't want to bring it home. And once you are done with your duties, take those gloves off, wash them. Make sure that they are sanitized so they can be worn again. So we want to make sure, that we're handling packages correctly. Many of us are compliant with staying home, but we're also having deliveries made to our homes. So we want to make sure, that we are cautious about that we may need to spray that box that came from Amazon and make sure that, it doesn't have any contagions on it. So we want to be mindful of those things so that we are doing the best we can to not spread the disease nor contract it. Also, think about what usually works for you when you're stressed. Make a list. Please include the following on your list. We want to make sure we stay connected. We may not be able to go over to our neighbor's home or our family members, but it's important that we stay connected to our community, our friends, and our loved ones. We can do that by telephone. There are so many different sophisticated ways of the video conferencing, Zoom, or virtual video. I don't know all the names, but there's so many venues out there by your cell phone, your computer, different ways that we can maintain contact. It is suggested also that we exercise. That's one I'm trying to get on board with, but it is important. If we're sedentary in our homes, it's important that we get up and move for our own blood circulation. It is suggested that we do 60 minutes a day. It's important that we have a healthy sleep pattern. We practice going to bed and waking up at the same time each day to maintain some level of consistency and structure. It can become difficult to maintain being sheltered in place. And so that's why it's so important that we have some type of structure that's unmovable and that we're willing to commit to. We want to make sure that we maintain a healthy diet that when we are shopping for those essential things, that we are picking up the items that we do need to make sure that our bodies are healthy. We want to make sure that we are making ourselves available to receive mental health or behavioral health support. Those things are important as well. We are not nomadic. We can't do this alone. And if there is a need for such services, please reach out and get those services. One of the other areas that's to address is mindfulness. What is suggested is that we do engage in some form of mediation and or prayer. We want to make sure, that we are in tune with ourselves. We want to make sure that we are communicating our needs effectively. We can utilize prayer as that time of mindfulness so that we can get back in tune with who we are. The last step I want to share with you is the step where we're working that program. Now that we have set up the program and we have it in place, we have to execute that program. We have to make it happen. We need to make sure that we're practicing the structure that we have in place. And it's important that it's done on a regular basis. If we miss that regularity, it's easy for us to fall back into more sedentary states and where we begin to lose track of what day it is, what time it is, and that creates other issues. You want to check in with yourself on a regular basis. Monitor how you feel. Monitor how you are addressing issues that come before you. Monitor your temperature, meaning that your anger, your irritability. We want to monitor those things within ourselves. We want to go back and analyze the program that we do have in place. If there is a need to make some changes, we need to make the changes. And we need to be willing to do so. And again, I express that we reach out for mental health services when needed. It is viable for our continued success in the things that we have to endure. What I'd like to do is to share some telephone numbers with you that will be helpful when that need arises. As the medical profession is open, that includes mental health. So the Sacramento Mental Health 24-hour crisis line can be reached at 888-881-4881. Mental health services can be reached at 916-854-8897. You can also call the church here at St. Paul Missionary Baptist Church. And the church has a directory and have contacting services that can direct you in the direction you need to meet your needs. And that number is area code 916-737-7070.
We would like to thank Rhonda Love for sharing with us today. Thank you, Rhonda. We pray that this has been helpful. Stay safe, well, and be blessed.
The following mental health resources are available to you. The Sacramento Mental Health Crisis Line by contacting 888-881-4881. Mental Health Services at 916-854-8897 and St. Paul Baptist Church at 916-737-7070. Thank you and have a blessed day.